So if we have somebody in quarantine or somebody in isolation and a workplace is asking them to work, then I can say, no, you cannot work, you're in isolation, that type of thing. But an employee can be more restrictive than the health department. So as employees, even though we do not have a mask mandated, if that was something that your legal guidance said that you could do, that would be completely up to you. And again, like I said, I'm a nurse, I'm not a business individual, so you would know more about that than myself. The next one, are we in danger of becoming a hotspot like Farmington? So anytime that individuals disregard social distancing, disregard staying home when sick, disregard staying home if quarantined, or staying home if a contact to a positive, if we would see that happening in our county, then we would see a hot spot. We could develop into a hot spot. We are seeing our numbers increase, and they are going up between 10 and 15 a day is where we're going right now. So we are seeing an increase of cases. And like I said at the very beginning, those cases are being able to be tied to another positive case, but I can't predict if that's going to change. It's basically going to depend on our residents of our county and how well people are going to social distance and going to hand wash and going to do those things. So it's our county, it's our responsibility. Each individual in our county has an individual responsibility to practice good practices to prevent ourselves from becoming a hotspot. The next one, what point after recovering from COVID-19 is it safe for me to donate blood or plasma? So there is actually a website that you can go to. It's called coronavirus.gov. And if you type in your web browser coronavirus.gov, it'll take you to a site that you can scroll down, and it says how to donate plasma. And you can click into that link. It gives you a questionnaire that you fill out, and it submits it to the people that would screen you for potential donation. I believe that you have to be recovered from your illness for at least 2 weeks prior to being able to donate. But I don't know all of the specifics, but the best place to go would be to that website and go from there. The next one says, I see medical experts on videos on Facebook saying there are certain drugs that everyone who gets sick should be prescribed, but the CDC says they shouldn't be. When I get sick, my family pestered me to call my doctor to get some. How are we supposed to know who to believe? So I believe you should believe your family physician. If that's who you have seen and they know your body, some of these medications that do help with COVID, according to some, those medications have side effects. And so your physician knows you, and your physician knows your health and your health history. And so I recommend reaching out to your physician, because they're going to know what medication is safe for you and what medication is not safe for you. I know there's a lot of things that you see on Facebook and a lot of things that are out in the news, but truly your primary care doctor is who knows you. And so that's the voice that I would listen to. The next one says, my family had COVID-19, but we have been released from quarantine now. Is it safe for anyone to enter our home? So anytime that an individual tests positive for COVID-19, they have to meet requirements to be considered not contagious. Those requirements are put forth by the CDC, and they were implemented and made because of studies done in a laboratory. Those studies were if they were able to replicate illness from cells that an individual sheds. So while your body is still shedding cells that are able to replicate illness, you're considered to be contagious. And they have found that the typical amount of time that they were able to replicate those consistently was 10 days. So the recovery time for a positive is 10 days, plus the absence of a fever for 24 hours without having Tylenol or ibuprofen, and then also having recovery of symptoms. So if you have met that recovery, then your family would potentially be still in quarantine after you are released from isolation. So you would need to make sure that your family was also released from quarantine. The reason why is because anytime an individual is exposed to a positive COVID-19 case, they can develop symptoms anywhere between 2 and 14 days after that exposure. So that's an incubation time that you could potentially develop symptoms. And during that time frame, we do ask that you quarantine yourself. So if you, the positive case has been released from isolation, but your home has not been released from quarantine, we do not want people to come over to your home. But if you have been released from isolation and your family has been released from quarantine, I do encourage you to clean hard surfaces in your house, just like I talked earlier about how we know viruses can live on hard surfaces for a period of time. So clean your house well, and then yes, you could have people over. We still would say practice social distancing, practice your 6 feet apart, just like we would say to the general public. So that's what we're recommending. Couple more here. Can anyone get a COVID-19 test? So your physicians, every physician in Washington County does COVID-19 testing. So you would call your physician and see if you met their criteria to be tested. There is different testing available. I know one of the other questions is where can they get a test at? So the hospital, all of their clinics do testing. Some of their testing that they do is state testing. You do have to meet as a criteria. You have to be exposed to a positive plus have symptoms. But that turnaround is 24 hours. They also test through Quest, which their turnaround varies depending on how busy Quest is. I've seen it 24 hours to 2 to 3 days. The other testing that you can get is at Great Minds Health Center. They do testing. They have a rapid that gives you results in, I believe it's 20 minutes. They also do the PCR that's sent off to a lab that they have, and they do testing. And then Dr. Terpstra in town, if you're his patient, he also could test you for COVID-19 if you met the criteria. So it's basically up to your physician if they believe that you need to be tested. So there is definitely testing available here in Washington County, and you would just need to reach out to your primary health care provider to get that testing done. We recommend that if you have been exposed to a positive case and you have symptoms, that you get tested. So we would want you to reach out to your doctor if you're not feeling well and you've been exposed to a positive COVID-19 case. Another one is my employees tested positive. Can my other employees get a test? So again, you would want to refer to your primary healthcare provider. I will tell you that every individual that is a contact to a positive case. So if you've had close contact, being within 6 feet for 15 minutes or more, and you were around that positive case as a close contact, then we ask that you quarantine for 14 days after that exposure. You could go to your doctor that very day and have a negative test, and you still would have to quarantine. This is an incubation period. So that test cannot predict if you're going to develop COVID-19 during that incubation. It only tells you if you have it at that current moment. So a negative test, as soon as you are exposed, does not mean that you are not going to develop COVID-19. And it does not mean that you cannot be, or that you can be released from quarantine. You still have to remain in quarantine through that 14 days of that potential incubation period. So for other employees that were exposed to a positive, if you want to get testing to alleviate your mind for that one day, you can if your doctor's office wanted you to do it, but you would still have to quarantine, and that test would only be for the day that you had that test done. What's the difference between a rapid test and the tests that are sent to the state? So two things, basically. One of them might be pretty important to some. The rapid test is just on the inside of your nose, and then the one that's sent off to the state, a PCR, goes back a little bit further in your nose. So the location of where the test is done is one of the things that is different. And then the other one, obviously, is time. So a rapid's going to be within 20 minutes, and then the one sent off to the state is going to be 24 hours, or the one sent off to a laboratory is going to be a few days. The big thing about that, though, is they test different things. So a rapid test tests for proteins. So if you've had symptoms for greater than 5 days, a lot of times your body's going to break down those proteins. And so you might test negative when you truly might have been positive. But if you get testing early, get seen early, then that would detect those proteins within the first 5 days. The one that's sent off to the state is considered PCR. It tests DNA. So it does pick up, it's more sensitive to pick up the DNA of coronavirus during any portion of your illness. So the state does prefer to have the PCR testing done, but the rapid is quick, and it is, if you're within the 5 days, it is a good tool to help pick up those positives more quickly than we would sending them off to the state. And then the last one's what the average time that it takes to get a result, if not a rapid. And so if you go through the state testing, you do get the results back within 24 hours. The doctor's offices that currently do state testing is any of the clinics with the hospital, and then Dr. Terpstra if you're his patient. So they do those things. They do that testing, and it is available to you. And so you do have to meet some criteria. You do have to still be seen. And then that turnaround is within 24 hours. If you go through Quest or LabCorp or any of the other labs, it's truly just dependent on how busy that lab is on to what the turnaround time is. And it varies, like I said, between 24 hours and a few days. So that's pretty much the end of the questions I have on here. Does anybody have any questions for me?
What's the one thing that you would tell people who think this is all a hoax?
Sure. So we actually get those people almost every day. So we have a lot of people that do feel like it's a hoax. And I would say that the proof is in the amount of people in the hospital right now and the amount of people that are truly ill. And then when you hear the people that have had it speak about the illness that they have had. So some individuals that have had very minor symptoms, they still know that they were ill. And then you have individuals who are now in the hospital, and I would say, ask them, find a positive and ask them their opinion, because they're going to confirm to you that it's not a hoax. It's not it's not an illness that should be taken lightly. It's not an illness that is a joke. There's people who have lost their lives. There's people that are currently fighting for their life. People from our county still in the hospital. And so I would say that the proof is in that fact that there are people who truly have been affected by this. And I would say to look at that. You cannot fake an illness. You cannot fake not being able to breathe. And so that's definitely not a hoax. Does anybody else have questions for me? Okay, well, I do want to let you know, like I said at the beginning, at the health department, we are available to you. If you do have questions, you're always welcome to reach out to us. We would be happy to help answer any questions that you do have. Also, I just want to thank you as businesses for being concerned about your employees and for being interested in how to keep them safe and how you can respond as an employer during this time frame. So I believe it's very commendable that you are concerned, and I'm very thankful for you being here today and allowing me to speak to you. It's definitely a privilege to speak to businesses and to be involved in something that's definitely out of my scope. Like I said, I'm a nurse. I don't do businesses, so I consider it a privilege to speak to businesses. And thank you so much for having me today.
All right, Rachel did a great job. I know I learned a lot, and folks, she did that all without notes. So I would guess that she's had these conversations multiple times. So thank you so much, Rachel. We really appreciate it. Next, does anybody have any member announcements? Does anybody have anything that they would like to share about their business or what's going on in the community? Going once, going twice. Okay, so next we just have upcoming member events. There are several places that you can find out what's going on in Washington County. They're listed on the agenda that you have. There's our website, which I will tell you right now is not up to date. We're working on that. There are also information on the Washington County Guide, our newspaper, the Independent Journal, which also you can visit their website or subscribe. I highly recommend that you subscribe to our local newspaper, by the way. They do an amazing job, and I really enjoy reading it every week. It's amazing the things that you will find out reading the newspaper that you won't get anywhere else. And so the other place that that you'll often find a lot of information, not only just about Washington County, but in the region, is b104fm.com, their calendar. And they're also a very valued member of our chamber. And so if no one else has anything, we're going to wrap it up. Like I said, we'll be getting back to you to let you know if we will be meeting next month in person or virtually. If you have any feedback about that, please let us know. You can always contact us at info@washcomochamber.com. We are currently looking for an executive director. So if you know someone who you think would be good for that, please refer them to us. We are accepting applications and hope to be interviewing very soon. And I think that's all I have for everyone for right now. Again, thank you so much. It's definitely a challenging time for our businesses, a challenging time for our families, employees and employers. And so I just encourage everyone to be safe and to be kind. Thank you, and everyone have a good day.
Thank you, Janie. You too.
Thanks, Janie.